Okay, so we'll call the meeting to order. We have a quorum. The date is Monday, September the 11th, 6:02 p.m. And the first order of business is we have before us the 3:29:23 minutes. Does everybody have that?
Mm-hmm.
Jim, can you put that up for everybody to see just in case they want to refer to it?
Yes, just bear with me. Why I'm not prepared to put minutes up is beyond me, but just
All
bear
right,
with
well, everybody's got the minutes, right? Does anybody have any comments to make about the minutes?
No comments.
me. Yeah, I can't pull them up right now.
Okay, these are the three 29:23 minutes. Can I have a motion to approve the minutes?
So moved.
So moved.
Second? Is there a
Second.
second? Okay, all in favor? Do we have a roll call vote on there, Jim, or do you want to just do it?
Dr. Ledice,
Yes.
Diane,
Yes.
Joanne. I think that's a yes. Dr. Kearns,
Yes.
Carissa,
Yes.
Dr. Kenny,
Yes.
Dr. Lefferman,
Yes.
Dr. Blagg.
He's muted, I think.
I see him. Let's see, Dr. Westpfizer.
Yes.
I think that's all my board members. I have a bunch of people on phone numbers. I think I got all my board members.
Thank you. Okay, now before I open up the citizen speak time, I'd just like to thank our recently retired Stockbridge board member, Dr. Henry Zwerner, for all of the years that he put in working on the Stockbridge board and with the Tri-Town Boards of Health. And I want to welcome our new member, Dr. Elias Lefferman, who's now with the Stockbridge Board of Health. Elias, you just want to raise your hand there so everybody sees who you are. Thank you very much.
My pleasure.
And so at this point, I'd like to open up the citizen speak time. What I'd like to ask anybody who speaks is very simple. Please identify who you are in the town you come from. And for this particular evening, I'd like to limit the speaking to 3 minutes, unless we find there isn't a lot of demand for the time, in which case, if somebody wants to speak longer, certainly that'd be reasonable. So please open up the citizen speak times. Zach or Jim, are you going to be managing opening up that?
I'll be managing that, Mr. Chair. People can just raise their hand and I'll ask you to unmute. Okay, for those that don't know how to raise their hand, at the bottom of your Zoom, you should have an option called reactions. If you click that, there's a big bar that says raise hand.
Is okay if there's somebody out there who's trying to do this and they're not able to do it as we go along, if you finally figure out how to do it or get some other thing, then we'll accommodate that when you finally get that chance. Otherwise, since there's nobody wishing to speak at this point, we'll move on to the next agenda item unless there's some comment about that. So the next portion is the collaborative updates. Jim, do you want to take that?
Sure. Thank you, Mr. Chair. Chair Romeo from Lennox asked that we put the foot care update on the agenda. So as everyone is aware, through Tri-Town, the Southern Berkshire Public Health Collaborative is a compilation of 12 towns where we have a comprehensive nursing program and about to be a comprehensive inspection program. We do a lot of blood pressure clinics and other services to a bunch of South County councils on aging, blood pressure monitoring. We're going to, at some point, we're going to be trained on falls prevention. Obviously, today marks our launch of our fall 2023 flu vaccine program. But whoever's not speaking, if you can just put that on mute, please. In one of the common threads that keeps coming up about at the council on aging level is not enough resources for foot care, which is a specific service provided to seniors. You have to be trained and certified to do this kind of work, and we're not equipped to do this. So we're working with Lennox and some other communities to see what other resources are out there. There's a foot care of the Berkshires program where they come out and they have a separate contract with like Lennox and some of the other towns. And I guess folks that have been providing the foot care services are retiring. So there's a huge gap in that. And so we're trying to play like a facilitator role to try to see what kind of resources are out there. It's not really an action meant for the boards of health. It's really just an update that we're trying to identify services and resources out there to provide this service for our seniors, because it seems to be in very high demand. So I don't know if there's thoughts, comments, feedback from any of the board members on that topic.
No, I'm just hoping we can eventually get something for the towns, because I know it's a sorely needed resource that is not available to a lot of people.
The people that are doing it now, they're all retiring, you say, or
Most of them,
most of them? Yeah.
There was two groups that are retiring, and foot care nurses of the Berkshires, they're out of Greenfield, but
Yeah.
they're setting up contracts, but there's such a demand. There's like a waiting list for this program. And so I'm just putting that information out there. If you hear or see or know anyone that's a retired nurse that wants to work not for free, but on the cheap, that wants to provide this service, let me know.
My sister-in-law lives in Plainfield and she's a nurse and she does foot care, but I don't know if she would come to into this area. I'd have to check with her.
well, there's a thought.
Yeah.
No.
I know you have to be certified, so
I
that's
believe she's certified.
okay.
She's an RN and I believe she's certified, but I can check.
Thank you. Thank you for that.
Do not either of the hospitals provide any of this service? Either Fairview or BMC, do they have, they don't have a?
I don't think so. I don't think so, Charlie.
When I think with and also too with the diminishing services for South County for VNA, that's putting a damper on certain services as well.
Hmm.
Flu clinic schedule. Today is our launch of the fall 2023 flu clinic program. We're doing Friends and Family today. The list of schedule is on the Tri-Town site. We are offering state supplied flu vaccine, private purchase, high dose. We did put an order in for some egg free. We're a couple weeks behind on that. As I spoke to the Lennox Board of Health previous to this, once the COVID vaccines become available, we'll put an order in for those. They are private purchase. We have to pay at cost for our COVID shots, which are around $120 per dose. And so we're going to have a series of regular flu clinics where we can't provide the COVID vaccines, but the staff will take an inventory on the demand, and then we'll start to offer those COVID shots and fold those into our regular flu clinics as we progress through the year. Again, they're really expensive, but we're pretty committed to making sure our residents get access to COVID shots. And we should be able to order as needed supplies with a very short turnaround time. So there was concern from me about committing to a high amount of vaccines and then sitting on shelves. So I think we're going to be able to order through Pfizer, X number, and then as we go through those, we should be able to keep that going. Let's see. So if you have any questions on that, flyers are out. We asked for people to pre-register. The vaccines are free. We just ask everyone that if they have insurance to make sure that they have that. We are supporting our clinics with some language folks that can help us with Spanish speaking and bilingual services, as we're seeing more of a demand for that. Hopefully down the road, we're actually going to be looking into hiring a community health worker that will actually help us with some of the equity gaps in Southern Berkshire County. Staffing updates, Tri-Town does have an advertisement in the paper to replace Jason Dragonetti, who's one of our health inspectors. He's actually converting over to the Southern Berkshire shared agent position, but we'll still have access to him for a while. And so that position's posted in the paper as well. And one other topic regarding vaccines, we're actually engaging our boards of health to see, we're trying to come up with different ideas about expanding our vaccination program to possibly shingles and other vaccines. It's something, we're engaging our current medical director, who's Dr. Kenny, by the way. Dr. Kenny is not only the chair of Tri-Town and the chair of Stockbridge, she's also our medical director for Tri-Town and the collaborative. Trying to figure out ways how we can expand this program in an affordable way where there could be a demand for these. So if there's any ideas and thoughts about possible vaccines that we don't typically administer, I'd love to hear your thoughts and feedback as we move things along. That's sort of where I'm at for number 4C. Any questions?
Nope.
It's a good crowd. All right, quickly moving on. I did send to everyone the Southern Berkshire Public Health Collaborative fourth quarter FY23 disease report. If you've had a chance to look it over and you have questions, let me know. We are tracking COVID cases and all the other communicable diseases. I mean, nothing major stands out. We had 20, this is April to June of 2023. We had 22 COVID cases in Lee, 24 in Lenox, 11 in Stockbridge, and a series of Lyme and norovirus, and nothing that's earth shattering, but something, to pay attention to as we look at all these communicable diseases and trend these out over time. If there's any questions from the board related to that report. All right. Lake testing. So Dr. Kenny and I have been working closely with the 3 towns. If everyone remembers back in 2018 when we had our cyanobacteria bloom on the bull that canceled the Josh, Stockbridge put together a subcommittee which has now evolved into an actual Stockbridge Bull Commission. And so Stockbridge engages with a contractor that does lake management and sampling of Stockbridge Bull for a variety of purposes. And this summer, we had a couple early scares where we got some complaints of a potential algae bloom. And although we sort of understood it was too early for that. And so Dr. Kenny and I have been working with the 3 towns, and we actually purchased a fluorometer, which we have the capabilities of going out and collecting a sample on Goose Pond, Laurel Lake, Stockbridge Bull, and that will tell us a very quick reading on whether or not we have potential cyanobacteria in the bull. It doesn't give us very specific numbers, but it gives us a range that there's a potential, and then we can follow that up. And that gives us sort of like a field test to kind of understand what we're doing. It was a very expensive device. It was around $5,000, but we got the buy-in from all 3 towns. All 3 towns pitched in and gave us the money to purchase that. And then I actually just got a training on it a couple weeks ago. And so it's a tool as part of our tool chest to get an understanding on what's going on. Because, if we get a bloom, if we issue a full lake advisory, we can't do partial advisories. We basically issue an advisory, no one can use that water body. So what we were doing before, we were relying on a consultant to come out, collect samples, send it to the lab. 2 or 3 days later, it comes back, oh, there's no cyanobacteria. And then we lifted the advisory. So, and Charlie, I don't know if you want to dive a little bit deeper into this, but it's a collaboration where we were able to get all 3 towns to help us purchase a device in the best interest for all three towns on lake water quality management.
Yeah, thanks, Jim. I'll just make a 1 or 2 points over and above what Jim said. First of all, I think this is a minor point, but I don't think the Joshua was canceled as a result of that cyanobacteria bloom. My recollection is that they just simply had to reroute the water activity. Is that right, or what happened? I think at any rate, that's neither here nor there. The real idea here is that the DPA, the DPH has relatively strict guidelines for what we do to determine if there's a cyanobacteria bloom. And in a nutshell, what it is that the entry into this paradigm is the observation of a visible scum on the lake. There has to be a visible scum. And then what happens is somebody who's knowledgeable looks and confirms that this seems to be potentially a cyanobacteria bloom. And the Board of Health is asked under the DPH guidelines to issue an advisory. Now, heretofore, the advisory, there isn't a guideline for saying where that advisory should be in a lake. So, for example, the reason for that is in the Stockbridge Bowl, for example, if you can understand, there are always cyanobacteria in the lake, almost always. They're always in the lake. If they're down at about 30 to 40 feet where they reside most of the time during the early summer and through the spring, they don't bother anybody at all. We don't have any reason to do anything. But what happens under certain weather circumstances and with the particular kind of cyanobacteria that we have in the Stockbridge Bowl, which is called Oscillatoria or Planktothrix, the cyanobacteria rise up usually later in the year and often under the ice. So we're not bothered by them most of the time. But the idea here is we don't test the water to see if there are cyanobacteria and then call an advisory. We have to see a visible scum, which means the cyanobacteria have come all the way to the surface, to the top. And they present a problem there because the toxins are released when the cyanobacteria die, and presumably we're going to have a lot of cyanobacteria dying all at once. That's why they're floating on the top of the scum. Whereas if they're down below, very frequently they're not releasing the toxins in a way that we have to be concerned about. Now, the device that we purchased is called a fluorometer, and it relies on the fact that cyanobacteria have a certain photosynthetic pigment that when it's stimulated by light, absorbs the light and then re-emits it as a fluorescence at a certain frequency. Whereas algae, real algae, that are also present in the lake and can also present as a visible scum when they're subjected to this light and you look at it through the fluorometer, they emit a different frequency. So using this fluorometer is useful if we see a visible scum. We can use the fluorometer then, and if we can test the water right near the scum and we don't find any evidence of cyanobacteria, then we don't have to call an advisory. It gives us an additional way to confirm that it's algae. We don't have a big experience with cyanobacteria blooms on the lake, so this adds to our experience. Early in the spring, we had the algae come up, and what we had to do was temporarily issue an advisory. We had some experts come in and test the water and actually look at it to confirm that it wasn't cyanobacteria, and then we could lift the advisory. But otherwise, according to the state regulation, or not regulations, but the recommendations, we're supposed to issue an advisory based on the scum and wait about a week for the state to come in to test it. And then we continue the advisory if it's possible after that. So it delays a lot of time. And you could obviously, with a busy lake, we don't want to be having advisories that we don't want to have. And so this device is very useful in that regard. And that's what it does. If there's a visible scum, we can determine that it's not cyanobacteria. That's the case. Now, The other way around, we can't say if it turns out to be positive, we can't do anything about it except call the advisory. Now, an advisory is not a prohibition to be in the lake. We don't enforce it. We don't say, ask for, we don't tell the people that they're going to go to jail or we're going to fine them or something if they go in the lake. It's simply an advisement that the cyanobacteria are in the lake and that people should be aware of it. And this brings up a second point that I'd like eventually to put on the agenda and talk to people about, which is there a way that we might eventually look at the idea of a partial lake advisory, or let's say an advisory that was predicated on better knowledge about what's going on with the bloom, because the blooms are not all black and white, that it's terrible or it's not terrible. Sometimes they're relatively minor blooms. So eventually I would hope we can discuss that.
Who does the testing? The health inspector for Tri-Town, or?
No, Jim and I actually learned how to do it. Jim's been doing most of the practicing. So I would say that at this point, Jim would be the one that I would rely on to test it, at least using this fluorometer. Is that right, Jim? Are you reliable?
Maybe, I guess I'm reliable, but it's a new device, so I'm still working my kinks out on it. So yeah, so right now, we're not turning Tri-Town into a cyanobacteria testing program. It's really just a tool. If something, we get a complaint, we go out. It's a quick tool to give a very specific assessment on where we stand. I'm not going to be out there every day testing.
Excuse me, Jim. Let me just interrupt that to add on that point, because this is another area of possible confusion. Jim has been testing quite a bit, not just to get practice, but we need to establish a baseline of the intensity of the fluorometric response, because there are always cyanobacteria in the lake. And so there will be a baseline that we're going to be using, and we can discount that. We can work from that baseline up if we have a bloom.
And the complaint comes from an average citizen that's using the lake and might see some scum. So they'll call the Board of Health.
Yep.
Yeah, I've been out there a couple of times to look at them. And, as I said, we had that advisory a while back, and there are different people. Sometimes the harbor master will report it. Sometimes people will just see it from their boats or whatever, or from the shore. So there's a lot of different ways that we can get the complaint.
Is there anybody dedicated to making a report, though? Anybody dedicated to looking at the lake once a week, or is it just people who happen to call it in?
Well, I think there are a lot of people on the lake, so I don't know exactly if there's anybody dedicated to do it. Some people have evidenced quite a bit of interest in looking for it.
And when they do see it, if a boater sees it, how do they know who to call? Do they go to the shed at the boat launch, and there's a number there for them to call, or how would they know?
Well, I think what happens, generally speaking, is people see the scum and they report it to the town hall, and the Board of Health gets it, or Tri-Town gets it.
Is there a notice of that for people at the boat launch? Say, if you see scum, please report it to town hall?
Well, that's an interesting point. I don't think so. I haven't seen that ever as a recommendation from the DPH to be that proactive with it. In other words,
But do we want to be proactive like that?
that's why I'm saying it's an interesting point. I think that's a point that we might consider in the future, and you might bring that up as an agenda item in the future.
Okay. I ask one other thing. We have this fluoroscope, 3 towns paid for, it's expensive. What about neighboring communities that may not have it? Could we offer a service to them if they'd like to have us come over, test it for a fee to help offset the cost?
Well, and just that's another point that we could put up on a future agenda item. Just to answer that briefly, I know that Jim is busy doing a lot of things, and has, if you can understand the manpower, if you just, they're just looking for more, we're getting another advertisement to get more staff, and there are many other activities that the Tri-Town Health Department is involved in, so that the availability of the staff to just go out to other groups and and put out the services might not end up being economically a good idea anyway, because you're taking away from the staff when they could be doing, other kinds of things that would be more in the public's immediate interest, like restaurant inspections and things like that. But again, that's a point I think that if you want to discuss it, you can bring it up in the agenda in the future meeting.
Fine, thank you.
Any feedback or questions on that topic? Other than what's been discussed?
Mm.
Okay, agenda number 5 is just arbovirus updates. I know there's been a lot of conversation about it's been one of the worst years for mosquitoes and how to protect yourself, and there's been a handful of positive samples of mosquitoes, not humans. There have been 3 human cases of West Nile virus in this state, but not in Western Mass at all. It's one of those things where DPH does update the arbovirus information on a weekly basis. And, DPH does put out best practices on how people should protect themselves. And I know Charlie and I've had discussions about low risk, moderate risk. They do classify Berkshire County as a moderate risk, but there's a lot of factors that go into that. What I can say is we have no human cases in Berkshire County. So if people have questions related to arbovirus, they should check the website out. Mass.gov is a little bit archaic, but they do a pretty good job on giving routine updates on arbovirus.
Any further questions on that?
All right, Mr. Chair, moving on to number 6.
Okay, so the next item is the discussion of as I recall, John Kearns was in June, and I think we have a copy of the minutes to refer back to that. John Kearns put forward the idea that we should eventually have an educational session regarding the transportation of the toxic materials through the towns. And that was passed by our board unanimously at that point. And so at this point, we have it on the agenda to revisit the idea. What I'd like to do is to throw it out to people here to see what kinds of ideas you have. And John, you might take the floor in this since you made the original motion. What kinds of ideas do you have insofar as how we could carry on that educational session, what things you would want to see as part of that, and what motivates you to want to have it?
Well, Diane Romeo just sent us an email recently about an educational issue. I think I can turn it over to her. I mean, you had talked about that, right, Diane?
Well, not in a whole lot of terms, but I think it comes back to you with what you are the person that brought it up and we voted on it. So it's, what do you want to see happen as we move forward?
I think just a general education of the whole situation. What's going on. Transportation. Noel mentioned the loading it onto trucks rather. I think just the whole aspect of it to more familiarize ourselves with it.
Okay. Does anybody else have something to add to that, or to clarify that, or something specific?
I do. Hi, this is Bob Westpfizer. At least 2 points are brought to mind amidst a whole lot, right, of questions and uncertainties that are going on. One is that the Tri-Town, in my opinion, doesn't have the individuals with a skill set to appropriately monitor the transportation and potential aspects of this. Jim had appropriately brought up, months ago, the possibility of using available resources, whether they're from GE's funds or from town funds, to hire an expert or to have someone on staff who can monitor all of the sampling that's going to get done, all of the ratios of highly contaminated versus mid versus lowly contaminated sludge, et cetera, in the event that the dump is built. The management of safety along the whole process is important, and the transportation through our towns. I did note that Lennox hired a consultant for themselves, and that's an important option. I think that some consideration, if this is going to need to be monitored across our Tri-Town area, that there may be a role for Jim's suggestion to be entertained, and that's some sort of even a staff member to coordinate with the transportation monitoring, with the enforcement of it, with the details regarding reporting and all of that. So that's one comment, is that there may be a role for Tri-Town to advocate for, support, or even be the hiring mechanism for someone to help out with this vast area across 3 towns. You know, I kind of rolled both points into there. My second point was that I applaud Lennox for hiring somebody, and it also points out there are places where the various member towns of this body are at odds, and so we want to be open and always strive for the places we can work together, but decisions and efforts and political forces are at play in such a huge way. It doesn't need to be said, but forces that have influence to shift things, for instance, to be transported on Lee's Main Street are in play. The other, there is one more point that just came up, and that's it's difficult to sort out the perspectives. I mean, we have, for instance, the EPA stating that they're open to community suggestion, and I think there was even a recorded session on this in terms of transportation routes, in which and I felt strongly that the Lee Board of Health needs to be at least heard on interest in making sure that the fewest number of people are affected, whether it's the potential for a spill, which is actually, maybe fairly low impact, given the acute toxicity of the sludge is quite low, but the transportation, the noise, the diesel, the risks of accident and mishap, et cetera, are important. And so the EPA was going to take community input, but we have a quote, at least secondhand, from the EPA's regional director, Tagliaferro, who said they're going to advocate strongly for routes that all of our selectmen and many of our lay people are against. So there's that aspect of just, fighting the battle too, to some extent, and the fact that at various areas of this battle, our member towns will be at odds. So I bring up those kind of 3 points as something to think about, starting with the aspect of, who's going to monitor this, and is there a role for Tri-Town to be involved? Second, how do we go about do that? And third, to be aware of the fact that Tri-Town may not be the best avenue for oversight.
Well, I think that was very well put forth. Does someone else have something to add to what Bob just said? Well, I was struck when John made that suggestion a long time ago that I felt myself personally, even though I was interested in the process of what was happening, that in some ways I wasn't able to participate in the public input that the EPA had put forward with respect to this transportation idea. And by that, I mean this. I think, first of all, the EPA did a very earnest and actually very laudable effort to give the public information about what was going on with this horrible situation of PCBs. It was a no win-win. We couldn't make them go away, and the EPA had to figure out how to manage this. And they had scientific experts debating for years different aspects of the PCB excavations and all the different things, the concentrations, the risks, and everything like that. And then they would have public input after that. The public would be privy to the experts debating things and the different opinions, and then the public would put in inputs, and then the EPA would make decisions and do things that were related partly to the experts and partly to the public input. Now, in 2016, as a result of that process, the EPA decided that they were going to have an out-of-sight landfill, and there were certain transportation expectations related to that. Now, I don't want to revisit that decision, but the EAB did remand that decision to a closed-door kind of decision-making process, a mediation panel, and that took place over a period of time. And in February of 2020, the EPA provided a statement about what had happened and what it was deciding. I forget exactly the name of that statement. And thereafter, I think it was in July, opened that particular bit of information to the process that it had been used to doing for those all those years up to 2016. And it opened to the public the ability to comment from July through September, I think was the period of time. And then it closed there was an open meeting sometime, I think in September, where the public could actually have input. And I think there was a virtual access to that meeting. And then in December, the EPA used all of that information to make its final decision. Now, that was in a lot of ways very similar to the process that had happened up to 2016. But in my opinion, there was a very significant difference. And it was such a significant difference that in my opinion, it made the usual process that the EPA was going through in order to educate us not work. And that the reason for that is that, when this first announcement was made in February of 2020, in March of 2020, Governor Baker declared this area of Massachusetts in a state of emergency. The coronavirus was shutting down businesses. It was shutting down normal behavior. It was making people not do the things the way they usually did them. Business was not as usual. Businesses were closing. People were losing their jobs. People were afraid of getting sick. People were caring for people who were sick, or people were sick. There wasn't real broadband, universal broadband access through the Berkshires for people to participate in a virtual meeting in September. And I don't think that people had the frame of mind to really understand what was taking place because they had focuses or foci elsewhere. This board did. We had, and so did the Tri-Town Health Department. We were in the throes of figuring out something that we had never before faced. And our communities never before faced this. In my opinion, this is the reason that I think most of us, if anybody else feels like I do, and I think John must have felt that way when he put this forward, and Diane, that we did not really get the kind of education about this that we needed to in order to do the kind of job that we've been elected and appointed to do, and that the state expects us to do, and that is to ensure the public health and safety of the three towns. Now, my interest here is to be educated insofar as to understand what's going to happen. I'd like to know what's going to happen. As I understand, some of this hasn't been decided yet, so I'd like to know to the best of a possible ability what is going to happen. And the sole goal, from my point of view, is to learn how to cooperate, how this board can cooperate to our best ability to ensure the public health and safety. With whatever needs to take place, I think we should be, I think it's our responsibility to really know what's going to happen. Now, there may be some resistance to us trying to find out what's going to happen, because I know part of the paradigm that the EPA uses when they have public input is they have a limited window of opportunity and then they close it. And that's, I think, their obligation to do that. But as I said, I don't think that that was an appropriate paradigm during the coronavirus. The state of emergency was a different kind of situation. I think it needs to be recognized that way. And I would hope we could invite the EPA, somebody from the EPA, to actually tell us what's going to happen. And from that point, perhaps we can begin to figure out some of these things like Jim suggested. Should we hire somebody to help us to do things? Should the towns go their own separate ways? Is that the better way to do it? Should we bring in the police and the fire chiefs and the emergency management people to tell us their concerns? Should we be the coordinators of this so that we can help out our towns, or should we delegate that to somebody else? Since we don't know really what's going on, because in my opinion, we had a flawed educational process, I think we deserve to have that educational process, I would say, appropriately done. And I'm gonna make a motion that we invite the EPA to tell us what is going to happen and how we might best participate. I honestly think, just to add this in, that we haven't been privy to the different prioritizations that were used to determine that trucks should be used. For example, the railroad goes all along the river. If the transportation were by means of rail, wouldn't that take it out of the towns and eliminate the traffic hazards, eliminate the passages of these trucks, 47,500 truckloads past our schools, past the playgrounds, past the restaurants, through the towns, past Tanglewood, past Kripalu, past Chesterwood, past all of these places where the tourists come. If there's a single accident, how is Tri-Town going to be expected to respond? We don't have any guidance in that way. And in effect, really, it is our responsibility, at least as far as I see it, to respond. And I think that the EPA really does have a responsibility to recognize our responsibility and to educate us so that we can know how to best cooperate. And that's what I think our first step should be, to invite the EPA. I would also suggest that since the rest of the River Municipal Agreement was a closed door agreement, that we should have a representative from that group explain to us what some of their reasoning was in their decision making, insofar specifically as the safety and health issues of the truck transportation through the towns, let's say, would compare to other alternatives like the railroad. I'd just like to know how those considerations sorted out. I think in general, the public has the right in a democratic society to know that. And I don't think we have been exposed to that kind of dialogue. I totally had confidence in the dialogue before the coronavirus, or at least up to 2016. I understand the closed door sessions were justified in some levels. I'm not arguing against that. I'm just saying that as a result of that, there was an especial need and requirement for the EPA to take an extra step after that period of closed door conversation to enlighten the public that the proper decisions had been made, that all of the public health and safety things had been put into the proper perspective, and that the EPA was now making a hard decision, but it was the best one. And I'd like to hear what that decision-making process was. I don't think we've been privy to that in a way that the community could absorb it, because I don't think those public opportunities during the surge by the way, that meeting in September was in the beginning of the first surge of the coronavirus. It was not it was not a time for us to be able to be expected to understand such a complicated and important issue as the transportation of 13 years of transportation of material through our towns, and without giving us the opportunity to know about it. Now, I understand that perhaps the Lee Board may have invited the EPA. Is that correct? And they didn't come?
Right, the EPA, we invited them to the hearing that we convened, and they declined to attend in person and referred to us to their online documentation that details the proposed planning to date. And there is a lot of information, hundreds of, maybe thousands of pages of details that are available for review with regard to this whole process. It's huge. So they declined to come. They do have meetings. In fact, I think the EPA's meeting, there are two meetings this week. One, HRI, the Housatonic River Initiative, is I think hosting with a couple of people who are on this meeting, Bob Jones and Tim Gray. I think that's on Thursday. I think Wednesday is one of the EPA community meetings, during which the EPA either makes a presentation or at the very least is available for questions from public or attendees to that meeting. So they've had several of those types of meetings over time, and they may very likely say, okay, we'll sit down with you folks and have an informational meeting, but they could also say what they said to the Lee Board of Health, and that's, please refer to the volume of information available in our planning and documentation to date.
Well, I've looked at that site. I think it's an excellent site. I mean, I think there's a lot of very interesting information on that site. But still, as much as I've looked at it, I have questions. So, for example, I'm always looking at this relative idea of, I always think that when something is potentially hazardous, and I would say, I don't want to misquote the EPA, but I think that the EPA used as one of its arguments for accepting the change of the site of the UDF, and I'm not arguing to change that, but the transportation, of course, the decisions about the transportation then devolve from that because it's a different place to put the stuff. So we have totally different kind of idea. And that brings up the point that I think is very valid, is that the transportation ideas have not been decided completely yet, and I think are very, very susceptible to requests to revisit them. But the EPA, in using its in supporting its idea that the on-site UDF was a potentially more attractive idea, said that the trucking, and I don't remember the numbers exactly, but it said that the trucking fatalities from the transportation and the serious injuries would be less with the local site than if it was going elsewhere. Now, for example, I think that the total fatalities that they're predicting is only 0.42 persons. I don't know if that means that it's less than a 50-50 chance that one person is going to die or whatever. But in that discussion, there was also a reference to the idea that the train would present a potentially more hazardous situation for deaths and serious injury than the trucking. Now, from what I understand from the EPA may have used, and again, we don't have the information because we don't know this, and it hasn't been out, as far as I'm concerned, in a public forum that could accept true public criticism and input. The the decisions and the predictions about fatalities from the railway were mostly for the out of county site, and also used the track infrastructure that was present before the significant upgrades that came during the administration and as a result of the administration of Governor Deval Patrick, former Governor Patrick, so that and Mass bought the railroad in Western Massachusetts, and I think there were several $1 million put into that infrastructure. And it seems to me that that investment could be followed if there was going to be additional costs. Let me stick with the first point, which is about the desk, because I don't want to lose that point, or the forest from the trees there. It was hard for me to believe that the desk would be greater using the railroad than the trucking, because even if the rail construction, the construction of new staging, etc., staging is the additional, and all you're a modified expert on this, is the additional track and track infrastructure that is created in order to have side tracks and do different kinds of things the railroad needs to do besides just go back and forth. If those rail workers were not injured or killed doing that kind of work in Berkshire County, I don't think they would be sitting home reading the paper. They would be doing that same kind of dangerous work, subjecting themselves to the same risks, to the same serious injuries and deaths, doing it somewhere else. So that removing that aspect to it, what we really have is the deaths and the injuries of railroad workers somewhere else, and now we have 0.42 deaths from the trucking here, or what I think it was even up to a higher number when they were looking at the out-of-state transfer. But at any rate, I'm throwing out these numbers. They're probably not exactly accurate, although they're relatively accurate. What I'm saying is that I don't know that they're accurate or how they were determined, because we don't have the information available. I have it here and I read it to you, but it's not available. So we can't really educate ourselves and tell the people in the towns that, yes, it's not safe to use the railroad. It's not. And now, if it's economically not justifiable to use the railroad because it's going to cost GE more, that's a different argument than we're going to bring forward, on the health department. But honestly, when you consider the benefits of passenger rail service and developing the railroad, that it seems to me that focusing on improving the railroad, no matter what it costs, is something that all of Berkshire County ought to be interested in, for number one. And number two, as much as I think that GE needs to be called to task and held responsible for putting the PCBs in the river, much of Berkshire County profited from GE's presence here and from the activities that GE was doing during that period of time. And so much of Berkshire County actually profited during that same period of time from those activities. We all ought to be willing to take a little bit of a share, and our representatives ought to know that and step up and help GE out if cost is a prohibitive factor in using the rails. I think that's another discussion that's beyond us. But again, we haven't had the public forum to look at these questions in detail. So I think John Kern's recommendation to educate us is a good one. And I think the first thing we need to do is to start to invite some of these people who have decided, without really giving us the benefit of a full explanation, to do this so that we can understand why, what it will entail, and how we can best cooperate.
Charlie, if I'd like to make a comment. One is that although I consider myself a beginner in this area, I have a lot of experience both reading and discussing this with a lot of people who know, including folks at the EPA. Those that whole risk calculation opportunity for the risk of death if transportation of the sludge occurs on our streets or if it occurs on rail is flawed with hugely variable assumptions and attempts to predict the unpredictable. it also completely ignores the non-death events of markedly increased traffic, noise, fumes, et cetera, that are, I suggest, incalculable, and I think need to be considered. When all that's said and done, I think I would emphasize that you're correct. It's all about dollars. One of the things that came up via the EPA and conversations that have occurred with regard to rail transport is it would require tens of millions of dollars of infrastructure to develop a tail on the track to get to a PCB sludge handling site and then be able to load it. It would still require a lot of infrastructure there for dewatering and handling, et cetera. But just that tail alone across, violated wetlands, but is a huge project in and of itself. They don't build railways easily anymore. And so that's but I don't, quite honestly, I am skeptical about any data supplied from the EPA, and partly because assumptions and potential risks can be cherry picked to one's advantage. You know, the statement about lies, damn lies, and statistics. And I can't help but be skeptical about those risks and the fact that it's much more than the risk of death to pedestrians, other drivers and railway workers that's at stake. So I am, but your other point about some sort of invite, I'm welcome to. I would be interested in having them potentially educate us to what we see as our role. I'm skeptical about their but that's enough for me. Thanks. Yeah.
Thank you. Any other comments?
Yeah, if I may, I think that the rail through Berkshire County is significantly improved, but it's by no means complete. And if you look, for instance, along where the rail comes close to the road, and you'll see long stretches now where the continuous welded rail was laid down there next to the track probably 4 or 5 years ago and remains there. It's not been worked into the system. There are probably some weaknesses along the way, but it is improved. But to echo what Dr. Westpizer said, yeah, there would be a need to create a landing, a place to process the PCBs, to perhaps do the sorting of goats and sheep by concentration measures. Some of it is going to end up in the UDF, UFD, whatever. Some of it will be shipped out. I can't give you an estimate of what a rail landing would look like, or even where you could site it. Where would it be? You would still have to have trucks bringing the material to that site. But I'm not sure, as fond as I am of railroads, I'm not sure that the rail option is an easily viable approach to it. But on a broader scale, there have been a lot of issues that have been raised, which are all intertwined. Risks of spills, possible aerosolization from a truck load, some of which has been addressed. But the issue of how you route the trucks is yet another one for which there is really, I think, a lot of concern. They're going to be using Roaring Brook Road and and Willow Hill Road, those are not, I don't know, have you ever traveled up Woodland Avenue to the point where it turns into Roaring Brook on your bicycle even? It's a dirt road that's in poor shape. Willow Hill Road is in very poor shape, not suitable for heavy truck use. Those are just a couple of things. I would wonder what they're going to do with all of that. I have issues about whether or not the process, who determines which way this particular truckload goes. Has it already been sampled and known what the concentrations are? Has it been dewatered at the site as it came out? Or will there be a major dewatering site at the UDF? UFD. How will the trucks be handled? There's comments there that they will be lined, that they will have tarps over the top, that the dumps will be sealed. Just so many details that are missing, at least in the information that I've seen so far. I don't know. Are there any answers to those issues? Is the facility going to be the place where the processing occurs, or will the material be processed as it is dredged?
So, to my knowledge, again, not expert, but potentially knowledgeable, there will be sources of really mud from two mechanical methods. One, it's likely to be pumped, highly watered, has to be very much of a slurry to be able to pump it, and that will require stages of dewatering. There may be and are likely to be, like occurred in the Hudson River, dredging in areas. None of that has been specified in terms of exactly what geography along these sites are going to require how far will, for instance, that kind of suction and water slurry piped alternative. There will be dewatering at this site of the UDF or alongside it or right there. And trucks were proposed to be loaded at that site. But the plan to date is proposed and pending final clarifications about all these things, including, the specifics around how will tailgates be sealed, and all of that has been brought up as very high level concerns. I know many of them by us, by the Lee Board of Health, but many participants are quite concerned about this. So, but it's as of now just a proposed plan, and they're due, I think, in December for the next edition of granularity, so to speak, with regard to the specifics of the logistical operation.
Well, I think you both have raised some interesting questions. I feel like I've come into a lecture, 45 minutes late, and trying to catch up with what has gone on, by going to these meetings that the EPA has been putting forth since the epidemic to clarify what was brought out during the epidemic and that was decided behind closed doors before the epidemic, I think isn't working for me. And I think that just listening to some of the questions you're making, I think that there are certainly valid questions there that may or may not have been answered even by an appropriate educational process, but they're still out there. So I'd like to move that we do invite some of the people involved in this decision making, somebody from the EPA, maybe from the rest of the River Municipal Committee, to a meeting, let's say in about 2 weeks or so, to answer our questions, so that at least we can be in a position to ask questions of people who have the answers. You know, I agree with Bob. It's probably extremely expensive to upgrade the railroad to do a particular task that would involve moving all of the waste material. It might not be as expensive if you could cherry pick and balance between trucking and railroad. And it certainly would be offset by whatever the trucks are going to do to our roads over a 13-year period, running back and forth and over our bridges that have recently been, refortified in a lot of places. I'm sure that cost is not going to be a little cost either. So I'd like to just see those numbers, but the whole spirit of this that I'd like to go forward with, and I have to say, it's always been a privilege for me to be a part of this board, because during that unprecedented period of time with the coronavirus, you all took very difficult decisions, and you did them. You thought about them with compassion, and you thought about them with courage, and you came forward with good ideas. And I'm sure that we're going to move forward with this particular issue and with the same approach. But I believe firmly in education and understanding what's going on. So I'd like to make a move that we invite some people, such as the EPA, such as from the rest of the River Municipal Committee, maybe the people that signed the final agreement, whoever we need to come to speak to us to answer some of our questions. And I'd be very happy to entertain some suggestions from any of you, and I'm sure Jim can pick them up, about who we should invite, and invite them. If people don't come, they don't come. But we can't change that. But I think the whole purpose of this should always be in the front of our mind, is that we have a responsibility to our communities to do the best job that we can, and that we wish to cooperate as best we can to ensure the public's safety and health is preserved. So I'm making a motion that we invite people, as I said. Do we have a second for that?
I'll second that.
Okay, and I'd like to have if anybody'd like to discuss that motion any further, I would like to say that I'd like to have you send in suggestions for whom to invite to Jim, so that we can do that. And is there any other discussion about that before we vote on that motion?
Mr. Chair, I'll just add a couple things. First, I think I would welcome stakeholders from individual board members sent to me directly, and then we can convene and figure it out. Then I would have to coordinate a date and time. I know Diane's going out of the area for a while. I don't know if 2 weeks we could do it in 2 weeks, but we can figure out a way. Because I would want to draft a request and invitation with specific details on where to go for this meeting, and then kind of do all that. So I think it's a great idea. Just if there are specific people that we would like to invite, I just ask that you send it to me directly, and then I can figure out that invite list and kind of go from there.
Any other discussion? Can we have a roll call vote on the motion?
Sure. Dr. Lidice?
Aye, I do.
Diane?
Yes.
Joanne?
Yes.
Dr. Kearns?
Yes.
Dr. Kenny?
Yes.
Dr. Lefferman?
Yes.
Dr. Blagg?
Yes.
Dr. Westpizer?
Yes.
Carissa?
Yes.
I know we skipped over. I don't know if I know Bob Jones, who's the chair of the Lee Select Board, who was just nominated by his select board to be our liaison for Tri-Town. And I know there's a lot of questions being asked. And Mr. Chairman, I don't know if you wanted to recognize Bob to see if he had anything to offer. I think it's up to you. We're sort of past citizen speak time, but I know he's on the call, so I don't know if you want to recognize him, if he has anything to add based on what we just voted on.
Well, I would welcome input from all the town select boards. And I think, I know that Bob is ready to jump forward and speak when he has something to say, and I could see that he was available to do that the whole time, and I think he would have done that if he had something to say at this point. But I would encourage all the towns to contribute to the discussion, because I think the more information we have, the more our board can appropriately cooperate.
Well said.
I think we've moved to the end of the agenda, so I'd like to hear a motion to adjourn the meeting.
So moved.
Is there a second?
I'll second that.
All in favor?
Aye.
Aye.
Thank you all.